clearly?
Yes, perfect.
Thank you. Sorry, my voice, because I am sick. I am Dr. Gizem Gencan. I am a pediatric health and disease specialist. I am working as a research assistant at Yozgat Bozok University Research and Practice Hospital in Turkey. Now I will present to you our work called Autoimmune Diseases Accompanying Hashimoto Thyroiditis in Pediatric Patients. It's my presentation flow. Hashimoto thyroiditis is the most common cause of goiter and acquired hypothyroidism in children and adolescents living in iron-sufficient regions. Although autoimmunity plays a role in its pathogenesis, genetic predisposition and environmental factors are also important. Patients are diagnosed with the presence of goiter and the increase of thyroid autoantibodies in the serum, in addition to clinical findings due to decreased thyroid function, such as goiter, weakness, skin dryness, constipation, and decreased academic performance. Referral to affiliation may also be due to non-thyroid causes such as alopecia, vitiligo, atophy, and depression. Clinical picture in HD, it can range from athyroid to overhypothyroidism and hyperthyroidism. Previous studies have highlighted an increased prevalence and relative risk of other autoimmune diseases in patients with HD and their relatives. However, most studies evaluating the coexistence of HD and other autoimmune disease were conducted in the adult patient population and examined the prevalence of HD in non-thyroid autoimmune diseases. More studies are needed in the pediatric patients group. In this study, we aim to investigate the coexistence of other autoimmune diseases in patients with HD between the ages of 5 and 18 who were diagnosed and followed up in the Health Science University Ankara City Hospital Pediatric Endocrinology Clinic. Autoimmune diseases represent a family of at least 80 diseases that share a common pathogenesis in which immune system attacks its own body organs. Autoimmune diseases can be acute or chronic and can affect essentially all organs and body systems. Epidemiological studies strongly suggest that rates of autoimmune disease are increasing in industrialized countries. However, there is no definitive cure for most autoimmune diseases. These diseases usually progress slowly and therefore severe tissue damage may occur before the disease are clinically diagnosed. These observations strengthen efforts to diagnose autoimmune diseases before irreversible damage occurs, and therefore studies on autoimmune disease have increased in recent years. Hashimoto thyroiditis was first described in Japan in 1912 by Dr. Hakaru Hashimoto, who examined thyroid samples from 4 middle-aged women who had a thyroidectomy for compression symptoms. HD is the most common cause of goiter and acquired hypothyroidism in children and adolescents in iron-sufficient regions. It's characterized by lymphocytic infiltration of the thyroid gland, in which various degrees of cellular and humoral immune response are involved. I'm sorry. It's an organ-specific autoimmune disease that results in thyroid cells death mediated by apoptosis. It's observed 2 to 4 times more frequently in girls than in boys. It's known that HD is associated with various autoimmune diseases, and T1DM type 1 diabetes mellitus is the most common autoimmune disease in the pediatric age group. Apart from this, it's known that many other autoimmune diseases, such as Addison's disease, celiac disease, pernicious anemia, autoimmune thrombocytopenia, vitiligo, can be seen together. But the study data in the literature is insufficient. I will talk about celiac disease and type 1 diabetes mellitus, which are the two most common diseases associated with the HD in the pediatric age group. Celiac disease is a proximal small bowel disease that develops against gluten, a vegetable protein found in wheat, barley, rye, and oats in genetically predisposed individuals. In celiac disease, the clinic can be asymptomatic or it can be in a wide range from severe malabsorption. There are many studies showing the relationship between celiac disease and autoimmune thyroiditis, but studies are most conducted in the adult population. The most common autoimmune disease in HD is T1DM. T1DM is a T-cell-mediated autoimmune disease that develops in genetically susceptible individuals and results in destruction of insulin-producing pancreatic B cells. T1DM can manifest itself in many different clinical ways. Dry mouth, thirst, frequent urination, fatigue, and weakness can be present in a wide clinical spectrum, ranging from diabetic ketosis or diabetic ketoacidosis. In the case of DKA, a deep and rapid breathing, dry skin and mouth, smell of breath like rotten fruit, noisy vomiting, clinical findings ranging from stomach or abdominal pain to even coma can be seen. T1DM diagnostic criteria are after 8 hours of fasting plasma glucose greater than 126 mg per deciliter, or a random venous plasma glucose greater than 200 mg per deciliter in a patient with classic symptoms of hyperglycemia, or if the secondary plasma glucose level is 200 mg per deciliter or above in the oral glucose tolerance test, the diagnosis of diabetes is made. OGTT secondary plasma glucose levels between 199 mg per deciliter reflect a high risk pre-diabetic state known as impaired glucose tolerance. Autoimmune diseases can affect essentially all organs and body systems. These diseases, which include a wide spectrum such as SLA, GA, Addison's disease, vitiligo, autoimmune hepatitis, and vasculitis, can be seen together with HD. This study was carried out in 220 patients diagnosed with HD and followed up in the Department of Pediatric Endocrinology, University of Health Science Anchorage Hospital. Our study is a single-center, retrospective, cross-sectional study. The research data was uploaded to the computer environment and evaluated via SPSS. Patient's age at diagnosis, gender, family history, complaints at presentation, comorbidities, physical examination, and laboratory findings and clinical follow-up information were reviewed retrospectively from their files. Autoimmune disease symptoms and laboratory findings in the patient with HD and his family were recorded. Patients with missing file data and patients with chromosomal abnormalities, for example, Down syndrome, were not included in the study. The diagnosis of HD was made with anti-TPO or anti-TG positivity. In all cases, FT4, TSH, and thyroid autoantibodies, hemogram, fasting blood glucose, and biochemistry values were examined. Anti-DTG immunoglobulin A positivity was investigated. Thyroid ultrasonography results of all patients were evaluated. Clinically, the cases were classified as athyroidism, subclinical hypothyroidism, overhypothyroidism, and hyperthyroidism according to thyroid hormone levels. Those with thyroiditis findings on thyroid ultrasonography were recorded. Data analysis was done with SPSS 22.0 PKH program. 220 patients aged 5 to 18 years who were diagnosed with HD and followed up in the Pediatric Endocrinology Clinic of the University of Health Science Anchorage Hospital were included in this study. when the demographic, clinical, and laboratory characteristics of the patients were evaluated. 77.7% of patients were girls, and the mean age was 13.8 years. There was a family history of autoimmune disease in 36.4% of the patients. It was determined that 51.4% of the patients were athyroid. Findings of thyroiditis in thyroid ultrasonography were present in 95% of the patients. Anti-TPO antibodies were found in 97% of the patients, and anti-TG antibodies were found in 74% of the patients. When we evaluated the thyroid functional status of the patients followed up for HD, we found that 51.4% of the patients were athyroid, 40.4% were subclinical hypothyroid, and 8.2% were hypothyroid. In our study, the complaints of 220 patients diagnosed with hashimoto thyroiditis at the time of diagnosis were examined. The most common complaint of the patients was neck swelling, that is goiter, with a rate of 15.1%. There were various complaints at admission, mainly weakness, weight gain, pallor, and tremor respectively. Surprisingly, 10.5% of the patients didn't have any complaints. They were diagnosed during routine screening tests. In our study, 20.4% of the patients examined with Hashimoto thyroiditis were accompanied by additional autoimmune disease. The most common autoimmune disease in the patients was T1DM with 14%, celiac disease with 5%, skin diseases with 2.7%, and rheumatologic diseases with 1.3%. T1DM was accompanied in 14% of the patients we examined for Hashimoto thyroiditis. When we examined the demographic, clinical, and laboratory values of these patients, of the patients with HD and T1DM coexistence, 48.4% were male and 51.6% were female. The mean age of the patients was 13 years, and the mean age at diagnosis was 7.4 years. 40% had a family history of autoimmune disease. The mean HbA1c levels of the patients were 10.77, and the mean 24-hour urine microalbumin levels were 8.8. When we compared the group with and without additional autoimmune disease, the mean age of the group with and without additional autoimmune disease was similar. In both groups, female gender was dominant. However, the number of male patients in the group with additional autoimmune disease was statistically significantly higher than the group without autoimmune disease. The thyroid function status of the patients was similarly athyroid in the group with and without additional autoimmune disease. However, 66.6% of patients with additional autoimmune disease were athyroid, while 47.4% of patients without additional autoimmune disease were athyroid, which was statistically significant. The rate of subclinical hypothyroidism was statistically significantly higher in the group without additional autoimmune disease. When we looked at thyroid autoantibodies, no significant correlation was found between high anti-TPO and presence of additional autoimmune disease. However, a statistically significant relationship was found between high anti-TG and the presence of additional autoimmune disease. The incidence of additional autoimmune disease was increased by 2.32 times in patients with high anti-TG. When the relationship between autoimmune disease and gender was evaluated, 35.6% of the patients with additional autoimmune diseases were male and 64.4% were female. The mean age of patients was 13. There was no statistically significant correlation between the gender of patients, their thyroid function status, and thyroid autoantibodies. However, the incidence of CD was statistically significantly higher in female patients than in male patients. There was no significant difference between the incidence of rheumatological disease and skin disease in male and female patients. However, the incidence of T1DM was found to be statistically significantly higher in males compared to females. Considering the relationship between autoimmune disease and age, 13.3% of patients with additional autoimmune disease were under the age of 10, and 64.4% were above the age of 10. In both groups, female gender was dominant. Thyroid function status was similarly dominated by a thyroid in both groups. There was no statistically significant difference between thyroid autoantibodies, diabetes autoantibodies, and celiac autoantibodies. T1DM was the most common autoimmune disease in both groups. The limitations of our study are the small sample size due to the small number of HD diagnoses in children, the potential for missing data due to the data collection, and the reduced generalizability of results of the study due to the reporting from a single center. Meantime, there is a need for longer follow-up due to the possibility of autoimmune disease development in these patients at later ages. Results of 220 patients diagnosed with HD, 77.7% were girls, and mean age was 13.8 years. The most common complaint at presentation was swelling in the neck. Signs of thyroiditis were present in 95% of the patients. 36.4% had a family history of autoimmune disease. Additional autoimmune disease was present in 20.4% of the patients. The most common autoimmune disease was T1DM, 14%. Sorry. A thyroid was found in 66.6% of patients.
Sorry for that. I think we have some technical issue here. Just wait for a moment for Dr. Gizem to rejoin again. Sorry.
Okay. Do you hear me?
Yeah, but yeah.
Okay.
We're gonna see the slide though. Yeah.
I think there's connection problem. Can you see my PowerPoint?
Not yet.
Okay. Sorry. I am screening. Okay. Actually. Can you see my PowerPoint?
Yes.
Okay. Results. The incidence of additional autoimmune disease was increased by 2.32 times in patients with high anti-TG. The incidence of celiac disease was statistically significantly higher in female patients. The incidence of T1DM was found to be statistically significantly higher in males. Of the patients with additional autoimmune disease, 13.3% were under the age of 10 and 64.4% were over the age of 10. As for our conclusion and suggestion, HD is an organ-specific autoimmune disorder in which environmental and structural factors trigger the development of an autoimmune reactions against thyroid antigens in genetically susceptible individuals. As shown in our study, other autoimmune diseases such as T1DM and celiac disease are associated with this disease. It should be kept in mind that there is an increased risk of autoimmune disease in HD that affects both sexes and increases with age. Regular follow-up of HD patients, especially in male gender and with high anti-TG levels, should be done in terms of autoimmune disease development. Thank you to everyone who listened to my presentation.